Good afternoon. I'm Serena Collado, Director of Community Health for Robert Wood Johnson University Hospital, Somerset. Thank you for joining us for today's webinar, Singing the Mommy Blues, presented in collaboration with Friends Health Connection. Many new moms experience the baby blues during the first few weeks after having a baby, which can include mood swings, crying, and anxiety. For some, however, these baby blues are more severe and longer lasting, and they may be diagnosed as having prenatal mood and anxiety disorders. Our special guest today is Dr. Leslie Becker-Phelps, a psychologist at Robert Wood Johnson University Hospital, Somerset, who will talk about the normal adjustment and myths about motherhood, postpartum depression, and strategies to improve moods. We will begin today's webinar with about 20 minutes of a moderated discussion, followed by questions and answers from our audience. Dr. Becker-Phelps, thank you for joining us today.
Well, thank you.
If we can begin, let's start off by you telling us a little bit about yourself.
Sure. I have a practice in Basking Ridge where I see individuals and couples. And it's a general practice, but I do have a focus on relationships, so people's relationships with other people as well as the relationships with themselves. And to support that, I also do a lot of writing and teaching. A couple books out and work for WebMD, write a blog for Psychology Today. And the perinatal mood and anxiety disorders work that I do, the patients I see, is an extension of my focus on relationships. And I've been doing it since 1998 when I began a program for it here at this hospital.
Oh, wonderful. That's great. So, so obviously you have a very extensive background in this area. And so you have seen and heard the myths and misconceptions. So why don't we start there about discussing some of the common myths of motherhood and what is like normal in terms of adjustment to becoming a new mom. So could you share those with us?
Sure. The myths are, they're just like in our culture. So there's this sense that when you have a baby, it's supposed to be like this blissful experience. Everything's all positive and wonderful and it just all flows. And motherhood isn't necessarily like that. I mean, it's nice when that happens, but there's a lot that goes into being pregnant and having a baby. It doesn't always go the way we want it to go, so it's not purely positive. There are struggles with it. And also, when you have a baby, it's not like all of a sudden this maternal instinct, it kicks in, and then you know everything about raising a child. You don't. It's a learning experience. And sometimes it's really harmful to have the myth that everything's going to be happy and go well and you're going to know everything, because then women end up feeling like there's something wrong with them. In addition to that, especially for women who want to work and balance having children, there's this sense of mothering just happens, right? You have a baby, you can just grab the baby, put it on your hip or whatever, or hold it, and you're going to go on with your day like you did before. And the truth is, mothering, it takes time, it takes effort, and life is going to be different. So, it's important to know that and not follow that myth that, you're just going to pick up life, the way it was. So.
Very good. Thank you. So what do we mean when we say somebody has the baby blues? What does that mean?
So the baby blues, it's not a disorder. In fact, about 8 out of every 10 women have the baby blues. What does it mean? It means, you struggle a bit. You might cry, feel just disoriented, upset about things that are going on, being able to take care of the baby. But overall, you are still happy. You're happy you have your baby. There are some positive feelings. So this is a more kind of mild struggle. It peaks about 3 to 5 days after giving birth, can last up to 2 weeks. Certainly, if you are still struggling, even if it's relatively mild, but you're really struggling, after that amount of time, if that goes on for weeks, you may want to reach out for more help. Because the thing about the baby blues is that in that time, it does interfere with you being able to fully appreciate being a new mom. There's one other point I want to make, and I think it's important, because we often forget it's not just the mom, there's also the partner. And we know that partners also experience the blues or different mood disorders around pregnancy and birth. And so I just want to make sure we recognize that, because that's important, and partners or fathers often get lost in our discussions.
Oh, that's a very good point. Thank you. So can you explain, like we talked about baby blues, but what are perinatal mood and anxiety disorders, and what are the signs and symptoms with those?
It's a mouthful, isn't it? Perinatal mood and anxiety disorders. So let's start by saying, what's perinatal? Perinatal means when a woman is pregnant, as well as up to about a year after giving birth. So that's perinatal. Mood and anxiety disorders are different, emotional disorders that women can have during that time. There's a number of them. We don't have time to go in depth into them, but just to give you a sense, there's depressive disorders. So that depression, I think people have a sense of that sadness or just having difficulty getting going. Anxiety disorders, where you have a lot of worries about things. Now, these things are common, more common than you would think. So if you were to go to a mommy group, if there's 10 there, at least 2 of them. Have I lost you? Oh, okay. Okay. About 2 of them would have that. We have obsessive compulsive disorder, and that's for women who may have a lot of thoughts about worrying that their baby's going to, get very, very sick, or they're going to harm their baby. And then maybe they have compulsions to keep checking the baby, make sure everything's okay. It's very important, if you have fears that you're going to harm your baby, to know that it's a fear and it's in your head. Just because it's in your head doesn't mean you're going to do it. And that the fact that it's a fear means you really don't want to do it. So that's obsessive compulsive disorder. And we have bipolar disorder. People used to know it as manic depression. So the people have really big highs and really big lows. And there's great struggles with that. And then we have psychosis, which is really important for us to know about. It's rare. About 1 to 2 women in 1,000 get it. But these women often have hallucinations. So they might see the face of someone else on their baby, delusions, maybe believing that their baby is a demon. Their communication gets kind of jumbled. It can be confusing because they might seem like they're doing okay, and then you start seeing these symptoms. If you see the symptoms, if you even think you might be seeing the symptoms, immediately get the woman to a doctor, because that really puts her in danger and her baby in danger, and we want to get her the help that she needs so she can return to enjoying motherhood and having a healthy relationship with her baby. So that's kind of a broad brush stroke of the different mood and anxiety disorders. Oh, you know what? I forgot. One other one I should mention, which is either a acute stress reaction. So if a woman has a stressful or traumatic birth, she might have a stress reaction, or over time may develop post-traumatic stress disorder, where she might have flashbacks, or it really stays with her. And that could be from a traumatic birth, or even from trauma that happened before giving birth, and it just revisits from this period of time. And that's one it's important to know about too.
So you would say with all these disorders, they all stem from having a baby or being pregnant from the baby, like even with the signs and symptoms, or if somebody's saying, you know what, I've been upset, life's too tough, but they just had a baby. Should they be picking up and considering that could be one of these disorders?
Well, you want to pay attention because if they're saying, oh, I'm having a really hard time, it could be the blues. She gave birth yesterday and she's scared of what she's entering into, or 3 days ago. Remember, that peaks in 3 to 5 days. So it's the timing, and it's also how long it lasts and the intensity of it. Certainly if somebody is feeling like they're having suicidal thoughts, or they're not able to get up and take care of their baby, if it's really intense like that, those are very strong signs of some of these kinds of disorders.
So what would you say then would be the tipping point of when somebody should see that doctor? Is it that period of time that they are still having that feeling?
Mm-hmm. It's a good question, but what I'd like to do is broaden the question a little bit. When should someone seek help?
Okay.
And so when you think of it on that range, then at any point a woman is feeling any level of distress, reach out for help. Maybe it's to your partner for just emotional support, or family and friends for support, or maybe to have someone watch the baby so you can get some sleep. Sleep's a huge issue, very, very important. Or a lactation consultant if you're stressing about breastfeeding. Maybe you get a doula to help out. But doula, lactation consultant, I just lost my thought. But those kinds of help. If when you reach out and everything that you're doing may be helping, but it's not helping enough, and you're overwhelmed, absolutely reach out to your doctor. So you want to make use of whatever resources you have, and your doctor is within that pool of resources.
Okay, thank you. So I think you touched upon some, but what are the causes of perinatal mood and anxiety disorders?
There's three basic causes, or all the causes could fit into three basic categories. There's physiological. So if you have a history of bipolar disorder, there would be a physiological basis, right? Social. So financial stresses, relationship problems, social isolation, those kinds of things. And then psychological, things that you are upset about or you're struggling with. The struggle with becoming a mother, or your roles, or different things like that, as well as depression enters that psychological piece, or anxiety. So we have the three: physiological, psychological, and social.
Awesome, thank you. So what are the risk factors? If somebody, has any, indicators that they might be at risk for any one of these disorders?
Yeah, there's some very clear risk factors, and it really comes down to being self-aware and knowing to look at what's going on in you and around you. If you have a history of a personal history or a family history of a mood or anxiety disorder, you want to be aware of that and talk with your doctors about that up front. If you are having a difficult pregnancy or childbirth, a traumatic childbirth, that's a risk factor. Other risk factors are relationship issues. You want to be aware of those, talk about those. I know there's more, but it's slipping my mind. One thing I want to get to is that with the risk factor of, maybe this is why it was slipping my mind, I wanted to make sure I mentioned, if you have a personal history of some kind of mood or anxiety disorder and you're on medicine for it, it's very important that you talk with your doctor about the medicine. A lot of times people want to go off their medicine because they're afraid it's going to harm their baby. But the truth is, going off of your medicine can be harmful to you and your baby because you're not able to take care of your child in the way that you need to. So that's a big risk factor when people get pulled from their medicine thinking it's going to help.
Sure, and it takes the medicine a little while to kick in too in some cases? Because I often see patients that they don't feel it's working because it takes a while to kick in. Is that,
there's
that from your clients, the patients?
Right. There is the fact that it takes a while to kick in. There's also, when you're going through a pregnancy, there's such changes in your body, a doctor really has to be on top of managing the medicine. So there's when you start the medicine, it takes a bit to kick in, and hopefully your doctor will talk with you about that. And then there's also just the changes in your body, so how effective it is may shift, and that's got to be managed. So an active conversation with your doctor is real important. One of the things that I see is, and this is true during pregnancy or after childbirth as well as just in general, people feel like, oh, it's not helping me, I'm just going to stop taking it. Or it just, medicine doesn't work. And unfortunately, medicine doesn't work like that. It's not like a blood test. We automatically say, oh, you need this medicine at this dose, this is it. it's the dialogue that makes it work. So.
Very good. So what can you do or somebody do to prevent prenatal mood and anxiety disorders?
So, again, it's being self-aware, so you can know your risk factors, and then taking care of that. So you're going to your doctor if you have that history or you're starting to feel certain symptoms. That's a way to prevent. Getting educated, so like listening to this webinar or just reading a book or whatever, but getting educated, and then if you see signs of something or you have a concern, you reach out. There's an organization called Postpartum Support International, and they have some wonderful things on their website and in their organization. So there's support groups. So if you're feeling distressed, to just feel like you're part of a bigger community or people who would understand. So they have that. They have a directory of providers in your area who know about these kinds of struggles. They're a phone call away. You can talk and ask questions. So they have a lot of, I encourage people to look at them. I've recently begun adding a library to my YouTube channel there's a playlist of videos for women with perinatal mood and anxiety disorders. So you want to do that. Make use of your prevention means making use of your resources, like I said before. Reaching out for help. It's very important to reach out for help. And a big one, get sleep. Do what you can to get sleep. It's so often underestimated, and it's just amazing how much better you could feel when you allow yourself to do that. So you sleep either when your baby's napping or sleeping, or if you can't do that, get someone to watch the baby so that you can get that sleep for yourself.
Very good. That's a great point. Sleep is very important.
Mm-hmm.
So at this time, we can invite our audience to actually log on, and under chat, you can log in a question to Dr. Becker-Phelps, and we can present that to you. So while I'm giving our audience some time to type in some questions. A lot of what we know in healthcare, many women are really silent about this and don't seek that, with that being a little bit of a stigma. How, you're encouraging them, yes, to seek help, but what do you say to the women that are a little bit hesitant? Maybe they feel ashamed or something because they feel like they shouldn't be feeling this way, and they feel guilty.
Mm-hmm.
What do you say to those women to encourage them to seek the help?
Well, are you still able to see me okay?
Yes, I can see you. Yep.
Okay. So what I would say is, and this occurs a lot. Women will come in and they feel uncomfortable. And the truth is, we know, again, 8 in 10 women have baby blues. We're looking at around 2 in 10 women who have either anxiety or mood disorders, never mind the other things I spoke about. So what I say to them is, when you go in public, and my guess is you look around, you're like, oh, everybody else seems happy. How do you think they see you? Do they know you've got problems? That you're struggling? And they probably don't, because you're putting a face on it. And to know that they're also putting a face on their struggles. And so just because it looks like you're alone doesn't mean you are alone. And as you start to talk to women or other women, as you get comfortable with them, you'll find that they also have struggles. So that's part of what I would say. The other part is, if that's a really big difficulty you have talking, reach out to a support group. There you can go to a place where you're going to be talking with women who you can relate to.
Oh, wonderful. That's really good. Sorry, I'm just typing in for everybody to hopefully see where they can type in their questions.
Okay.
So what are some other common struggles? I mean, what I've seen is that people tend to make excuses. They know they're feeling some way, but they attribute it to other issues, even though it's not. It may be baby blues, and that's what I think I was trying to allude to before. So what do you say to them? Like when they're saying, oh, I'm just depressed about, this is going on in my life and it's not baby blues,
Mm-hmm.
prenatal anxiety disorder. They're attributing it to something else. How can they, how do they determine that?
Well, there's a lot of, what I do is I basically listen to what they say, and there's a lot of truth in what they're saying. Maybe they are struggling with all of those things, and we talk about, but you have a lot going on, and the transition to parenthood is so big, and that's a piece of this pie. It's a significant piece of this pie. So it may be what they're saying is true, it may not be the whole thing. And so what I have found is that when people start to get comfortable enough to start having that conversation, then it kind of clicks for them that, yeah, this is hard. And then they feel guilty about maybe having the struggle. And then as you become aware that other people have the struggle too, then that helps. Unfortunately, our culture doesn't help. In other cultures, there's so much more of a recognition of the transition. There's a lying in period where people take care of the mother. And there's much more support. Maybe there's more family around. We have this idea you're supposed to, but pop out a baby, and then get on with it. That's part of the whole myth thing. And so for people to understand that those are myths, and the reality is a lot more complicated than that. So.
Well, I think throughout your conversation, you'd also mentioned a little bit about treatments. You talked about making sure you're getting sleep. You talked about medicines. What other treatment options are there out for people so that, they can, be happy and enjoy that special time with your child? Can you share a little bit of some of those options for folks?
Sure. So certainly if you've been on medicine, I'm going to just reiterate that because I can't reiterate it enough because so many people go off and it causes problems. So take your medicine if that's what you need or you're struggling. Talk with your doctors about your concerns. But a big thing is, and this goes back to the prevention thing, is if you take care of yourself, right? So you're eating, you're getting rest, you're doing what you can to just take care of you, have a little space for you, then you're less at risk for either developing a disorder or it can keep it more limited. So reach out for those resources, get your rest, have your social supports. These are really treatments. The more again, it goes back. If you educate yourself and you understand what's going on, where your stresses are, then you can do what you need to do. Maybe it's a financial stress and you need to sit down with your partner or whoever and say, okay, how are we going to handle this? Because I can't be kind of freaking out all the time while I'm trying to breastfeed, or whatever it is. And then there's support groups, like I said, and Postpartum Support International is a great place to find out where there are ones near you. I know our hospital, we offer a support group, which is great, and a lot of hospitals do. And if you reach out for the support group, that helps. And then clearly therapy. An individual therapist who's been trained or has experience working with women with these struggles, then it's a lot of reassurance and support to help maybe figure out whether you have a mood disorder and you need more kind of the medical or a deeper therapy versus some support. Education, I will tell you, Serena, education goes a long way. I find that as people start to understand the myths versus the realities and what they can do to help themselves, a lot of the difficulties they calm down. The other thing is I will tell you that of all the patients, I see a wide range of patients. It's only with women with these struggles that I can be specific about time frames. So if someone comes to me and they do not have a history of trauma or psychiatric issues, but they're struggling with becoming a new parent, 4 to 6 sessions, and they're good. And I actually treated one person. I'm very happy about this. In one session, she came in, and I said, at the end of our session, I said, you know what? I want you to go home, tell your husband, you need to get sleep for this next week. This is I'll write it as a doctor's order if you want. Go get sleep, and then call me next week. And she called me back. She's like, oh my God, I'm all better, because she needed sleep. So some education about what you need and the myths and all that can really and just to get general supports can really clear up a lot.
Wow, great. So with moms, with counseling, if, you know, can they bring baby with? What is your recommendation? Is the ideal session without baby, with baby, or if women have no options but to bring baby, can they bring baby?
Yeah, I think it's great to bring baby. I have women bring their babies. I have a playpen that I set up if as the baby gets a little bit older, so they can have that. I think it's great because sometimes they have anxieties about interacting with their baby, or they don't want to leave their baby, so they can take them with, and then it's just a more, it helps them adjust to having the baby, and it's a part of their life. That said, there are times where it's not wise to have the baby. So if somebody is having a more serious mood or anxiety disorder where they need kind of very focused time, then I really encourage moms to get someone to watch the baby. Also, I know in my practice, I've added telehealth, which has become real important. So if a mother can't leave because of a medical issue, or she's not ready to leave the house with the baby, or as happened yesterday, a mom whose baby was sick, so she got to stay home, and we did kind of what the two of us are doing here, but we did therapy that way. If there's not a therapist in your area close to you who has training or experience with this, then you can find someone who does have the training, and you can do it from a distance, and then you can either have the baby napping and you keep an eye on the baby, or the baby could be right there with you, and maybe you can get some education about concerns that you have. So there's a lot of ways to work with that.
Okay. So you mentioned sleep being very important. So when we talk about mommy fatigue, and maybe how important is having mom have some time to herself, and if it is important, how does mom get that help if she does not necessarily have all that support structure that you had also talked about?
Right. Really good questions. Real good questions. The first part, I think, of answering it is to address the whole myth issue. That was one of the myths I think I forgot to mention, which is we have this idea that when you become a mother, then you give up your right to take care of you or to have your own life. You're supposed to be all about taking care of your infant and your children. And yes, I mean, they take up a lot of your energy, but it can't be all. You've got to take care of yourself. I often go back to kind of the analogy when you get on an airplane and the flight attendant says, if the air masks drop, you put the air mask on yourself before putting it on a child or someone who needs help. The reason? Because if you pass out, you're not helping anyone. So if you're not getting your sleep, if you are just feeling so lost, like you don't even exist anymore, and you're feeling so anxious or depressed, you're not able to be there for your baby. So that's a big first, and a lot of times that's a big one for people to get past. And they'll sometimes even throw excuses if I don't have anyone. It's less that they don't have someone and more that they don't think it's okay. So not only is it okay, it's healthy. And look around, you may find that there are supports, family, friends. Maybe you have a gym, and you can, we're not talking the first week you have after your child, but as the months go by, maybe you can leave your baby or infant or toddler with the staff there if they have a facility for that. Daycare. There's look for places where you can get that help or support. There may be even in your church or your temple, your synagogue, maybe there are people there who would be happy to help if you're really at a loss, both financially and then just isolated. Which, by the way, if you're that isolated, yes, it's good for you to have time for you, but I would say first step is to get less isolated and to find a way to connect. And so, you want to be doing that in all the ways, we said, like whether it's through religiously or, personally reaching out or support groups or whatever. You want to get those connections.
That's fantastic. Well, thank you for sharing. So believe it or not, this concludes today's webinar. Thank you all for joining us. Please remember that the opinions shared here today by our medical expert are not a substitute for medical advice from your physician. If you need a physician, please call 1-888-724-7123. For more information about Robert Wood Johnson University Hospital Somerset, please visit www.rwjbh.org/Somerset. Thank you all for joining our webinar and have a wonderful day.